Hey guys, this is Dr. Hub. Today we are going to look at the choanal atresia. So the choanal atresia, the first point we need to know is that it is due to the persistence of the bucco-nasal membrane. So it is due to the persistence of the bucco-nasal membrane, and what happens here is it separates the primitive oropharynx. So it separates the primitive oropharynx. So separates the primitive oropharynx from the primitive nasopharynx. From primitive nasopharynx. So what are the features of this choanal atresia? So when you look at the features, it includes, there is about 30% cases. So 30% cases will be bony, and 70% cases will include it will be mixed. Next is, there is unilateral greater than that of the bilateral, and in case of the unilateral cases it may be asymptomatic. So unilateral cases may be asymptomatic and it presents in the adult life. So in terms of the bilateral cases, what is present? So in terms of the bilateral cases, they are life-threatening. Bilateral cases are life-threatening and they are present in respiratory distress. They are present in the respiratory distress. So another important point to note is that there is a mnemonic called charge. So this choanal atresia are associated with charge. So let's see what each alphabet stands for. So C stands for the coloboma. So C stands for the coloboma of the eye. Next is the letter H. H stands for the heart defects. Next is A. A stands for the atresia. So this is going to be the atresia of the choana. Next comes the R. The R stands for the retarded growth and development. So R is for the retarded growth as well as the development. Next is G. G stands for the genital abnormalities. And lastly, there was E. E stands for the ear anomalies. So this is important, anomalies. So let's repeat. C for the coloboma of the eye, H for the heart defects, A for the atresia of choana, R for the retarded growth, then G for the genital anomalies, and E for the ear anomalies. So it is associated with the ear anomalies as well as the ear loss. Next is the CT scan. The CT scan, it includes the IOC. What is IOC? It means it is the investigation of choice. Next is, there is the intermediate management, immediate management if you see. So what is the immediate management? Immediate management will be by involves a placing of feeding nipple. So there will be, you place a feeding nipple, and this is with a large hole at the mouth. There's a large hole. So large hole is present at the mouth, and this is to force the baby to mouth breathe. So this is nothing but force the baby to mouth breathe. Next is, we are looking at the definitive treatment. So what happens in case of the definitive treatment? So in terms of definitive treatment, it consists of correction. It consists of the correction, and this will be of the atresia by a by a transnasal or the transpalatal approach So this was all about the choanal atresia. We saw how does it occur, why does it occur, and we saw the cases where unilateral being greater than bilateral. Then we saw an important charge syndrome, mnemonic. We saw what are the techniques which is used, that is the McGovern's technique, as well as we saw the treatment aspect of it. To learn and grow daily like this, please do subscribe.